that childhood hearing loss is a major problem in the world. Over 34 million children worldwide have disabling hearing loss. 60% of childhood hearing loss is preventable. Less than 10% of children in developing countries receive no intervention for hearing loss. I'm Dr. Joshua Delito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at common causes of hearing loss in children and what we can do to prevent childhood hearing loss. Imagine a child missing out on learning due to hearing loss. This could be a disaster. Why do children get hearing loss, and why does childhood hearing loss matter? Hearing is equivalent to brain development. So because for a child's brain to develop, he has to be able to get stimulation from the information outside. And if the child cannot hear, then his brain will be affected in a major way. Then the first 3 years of a child are critical for speech and language development. And this is highly dependent on the child's capacity to hear. Then undiagnosed hearing loss can lead to learning difficulties. So when the child has difficulties in hearing, then his capacity to learn will be significantly affected, and this will have his school performance. So a child with undetected hearing loss, it's 5 times more to struggle academically, because he cannot be able to comprehend and hear what is being transmitted to him. So early intervention can reduce learning gaps and help children to grow to their expected capacity. So let's take the necessary precautions to prevent childhood hearing loss. So what are some of the signs of hearing loss in children? Parents, teachers should be able to recognize these symptoms so that we take care of our children. So for infants between the age of 0 to 12 months, they will have no response to loud sounds, and the noise will not affect the child. If someone shouts, the child will not respond. So that stimulation from outside the noise is not there. Then they may not be able to say sounds by the age of 9 months. So when you see your child is having difficulties with the speech, think, could this be a hearing problems? For toddlers between the ages of 1 to 3 years, delayed speech or unclear words, because the child cannot hear, cannot learn words, and this could be a sign that your child could be having a hearing problem. Then for children who have a preference for high volumes, when you see your child is trying to put, if you give him a phone or the TV, he's putting very high sounds, then this could be a sign that the child has a hearing problem. So then if for older children above 4 years and above, if they have difficulties following conversations, and this could be a sign that the child could be having a hearing problem. Frequent what? Repeat it again. So when you see your child does not follow instructions, it could be you need to find out, could this child be having a hearing loss before you decide that the child is just being defiant. It could be a hearing problem. So what are some of the causes of childhood hearing loss? One, before birth, there could be congenital causes. These are things that happen before the child is born. You can have some genetic conditions which are usually transmitted from parents to the child genetically. Then maternal infections like conditions like rubella, syphilis, and that's why you see all mothers when they are attending the ANC care, they get tested for some of these things, because these are some of the known causes of hearing loss. Then you have birth complications. If a child had difficulty birth, then this could affect his brain, and this could affect his hearing. So these are some of the complications that a child can get. So after birth, we have acquired causes of hearing loss. These include like chronic ear infection. In some of the videos before this, I have talked about hearing ear infections, and if you have not watched that video, this would be a good time to go and check on that video and enlighten yourself on how chronic ear infection present, and you realize that hearing loss could be one of the complications of chronic ear infection. Then exposure to loud noises, this could destroy or damage the child eardrum, and this can be a cause of hearing loss. So avoid and try as much as possible to avoid loud music for your children. Then ear trauma for any cause can cause hearing loss. Then sometimes you need to know that just 5 minutes of very loud music could be catastrophic to your child hearing. So how do you diagnose hearing loss? There are some excuse me. There are some screening tests that can be done for children to detect whether they have hearing problem, and it is encouraged that newborn are screened for hearing before the age of 1 month. They can be done audiometry and tympanometry for older children. This is testing the children for the hearing, and the WHO recommends the rule of 1, 3, and 6. By 1 month, all children should be screened for hearing problems. So by 1 month, all children, and actually it is advisable, if possible, 98% of the children before they are discharged home, they have been screened for hearing loss. So this is a big challenge to our health system, that they implement this so that we are able to detect these problems at the earliest possible time. So by 3 months, the child should be able to go diagnostic testing and be confirmed whether he has a hearing problem or not. And then by 6 months, interventions to prevent the hearing loss should be in place so that the child is able to hear and live a normal life as everybody else. So how do we manage hearing loss in children? Some of the treatment options include: 1, use of hearing aids for mild to moderate loss. Then you can have some implants in the cochlea, that is the inner part of the ear, for those who have severe hearing loss, and this will help the child to catch up on the developmental milestones. And then you have speech and language therapy, which will help the child to catch up on speech and also aid in learning. So what is the role of the parents in diagnosing of hearing loss? So engage in virtual communication for the child who have hearing problems, and create a hearing-friendly home so that children can be able to learn language and also be able to diagnose hearing problems. So how can we prevent childhood hearing loss? Of course, there are simple actions that can save your child's hearing. So why not get informed? 1, for pregnant mothers, vaccinate against rubella and make sure that you start your antenatal clinic as early as possible. Preferably if you can start in the first 3 months, so that if there is any serious problem, it can be treated and taken care of. Sometimes we take some of these things very casually, but we do not know that in the final end, you may miss big, and your child could have her whole life affected because of a simple thing that you missed on starting your clinic on time. So please, you are a conscious parent, you need the best for your child, start your antenatal clinic on time. Then protect your child against loud noises. The music we play in our houses, the music we play in our transport system, it should be children's friendly. As I said, healthcare is a community issue. So the people who own the transport system, they should make sure that the music they play is children friendly. Then treating ear infections on time, knowing which ear infections require the attention of a health provider. Then, of course, I've said that by 1 month, all children should be checked for hearing problems. By 3 months, at least a definitive diagnosis for hearing problem should be made. And by 6 months, at least treatment has been started for those who have hearing problem. So it is important that you diagnose a hearing loss, take the necessary measures and let early intervention help your child to excel to her best. So a child who cannot hear cannot learn to speak. And so when you see your child has a speech problem, think this could it be a hearing loss? So think twice about it. So what can you do today? Be aware of the signs of hearing loss and take the necessary measures. Encourage hearing screening. As I said, as the health providers, we have a big challenge to make sure that hearing testing is done at the earliest possible for infants. Then we advocate for better hearing care. And this is very important so that we have children who can learn and be the best that they can be. So be part of that team. Protect a child's ear from loud noises. This is within our capacity. And also treating common ear infection on a timely basis and making sure that we are doing everything to improve the immunity of our children. I have talked about some of the things that you can do to improve the immunity of your children. Remember, every child deserves to be heard. And so, let's take the necessary precautions. Thank you for watching. If you like this content, please share. And also remember to subscribe to the Overall Health channel for more educative content. You can also follow us on Facebook, Instagram, LinkedIn, and also in TikTok. And you can also, if you have any issue that is health related, you can email us on the email address on this video, and also you can call us directly at Wellness Health Services, or you can directly message me or call me on the number on the screen. Thank you for watching.